Hello and welcome to Dialogue. As Spring Festival approaches, millions of Chinese are on the move to reunite with their families for the holiday. Meanwhile, health authorities are on alert to see if there will be a new wave of infections and are paying close attention to the rural areas. So what is the situation now in China's countryside? Are rural hospitals and clinics ready to meet the challenge of a new possible infection wave? To discuss these questions and more, I'm glad to be joined by Michele Geraci, former Under-Secretary of State of the Ministry of Economic Development of Italy, Dr. Yao Shujie, Chongqing Professor of Economics in Chongqing University, and Hu Naijun, Associate Professor at the School of Public Policy and Management at University of Chinese Academy of Sciences. That's our topic. I'm Xu Qinduo. Thank you for joining us, but let's start off with our correspondent, Yang Jinghao, who is in Kunming, Yunnan province, with the latest on the ground. Jinghao, welcome to the show. Yunnan is a province with a vast mountainous area and many remote villages and small towns. What is the situation in Yunnan in particular? How are the rural areas holding up so far?
Yes, as you mentioned, Yunnan is a typical agricultural province with about 23 million people living in rural areas. Actually, I just came back from some small towns and villages in western Yunnan. From my observation, the overall situation is stable at present. Actually, the vast rural areas experienced a wave of COVID infections in December when China just shifted the pandemic control policy. I learned from different rural hospitals that they saw a fast-growing number of COVID patients during that period of time, but there were few critically ill patients. Most of them have mild symptoms and only need to take medicines at home or receive outpatient care. For all I know, this is the case in most places of Yunnan. And I noticed that the grassroots level hospitals all have basic resources, including related medications, ambulances, and oximeters, among other supplies. But of course, they would be in short supply of some specific medicines sometimes, such as the fever reducer, ibuprofen, and some medicines. But they can get other substitutes. So I think this won't be a problem. And what I want to mention is that the so-called Health Service Alliance is playing an active role in response to the epidemic. The practice integrates resources among medical institutions at different levels. It means that the village clinics can get support from upper-level hospitals in terms of both personnel and medical supplies. It ensures that most of the villagers can get proper treatment in a timely manner. We know that Yunnan is known for its ethnic diversity. In some areas, local ethnic groups just combine their traditional remedies with the Western medicine in COVID prevention and treatment. For example, during the past few weeks, a hospital in the town of Ruili, a city bordering Myanmar, has been distributing a kind of soup made of traditional herbs used by Dai people. And I also noticed that most people who got infected with COVID have recovered, and they are busy with winter harvest and preparing for the upcoming Chinese New Year. So basically, I think the grassroots healthcare centers are able to meet the pressure, but of course, they need to stay alert as the Spring Festival is just around the corner.
Well, as you said, the Spring Festival, like 3 or 4 days away, and we are seeing millions of Chinese are on the move, from one place to another. So as the travel rush had started, of course, people are concerned whether there will be a new wave of infections, in particular in the rural area. So any updates, to the preparation by the provincial government and the governments at the grassroots level, for example, for another possible wave of infections?
Yes, actually, governments at all levels have realized this problem and started to prepare for another potential wave of infection ahead of time. When I visited a town in Baoshan City, the local government was surveying how many people would return home for family reunion during the Spring Festival so that they can take precautions. And almost all hospitals have opened fever clinics, and they will remain in service during the holiday. And of course, the grassroots hospitals are busy preparing for medications and sick beds. Now let's take a look at how the township hospital I visited days ago is getting prepared. Dr. Jiang Ziqiang works at a hospital in a small town in southwest China's Baoshan city. He said they've seen more patients in recent weeks, 600 one day at its peak, double the usual number, with the most showing COVID symptoms.
Most of the patients have mild symptoms. They only need to take medicines at home or receive outpatient care.
Jiang normally works at a city-level hospital. The so-called medical service community is playing an active role in response to the epidemic.
Since the COVID outbreak, we've arranged to have doctors from the city's #2 hospital and the CDC and some other institutions work at township-level hospitals from 6 months to a year. We hope this will provide people in rural areas with better access to medical resources.
Under this cooperation model, when a village clinic is unable to treat a patient, it can transfer them to a township or even a higher-level hospital more easily. Offering booster shots is one of the ways it's getting ready. Most of the elderly people in the town, with about 49,000 people, have received the shots. And the hospital is adjusting its operation strategy.
We've integrated the resources of the departments of gynecology and obstetrics, traditional Chinese medicine and surgery to reinforce the fever clinics and vaccination team. Now we have relatively sufficient staff and beds for another potential outbreak.
Having enough medication is also a priority.
We've reached supply guarantee agreements with more medicine suppliers. We started preparing a month ago, and the stock can last for 2 to 3 months. For some medications in high demand, such as fever reducer, we keep replenishing every day.
Jiang also visits clinics in villages regularly to give them guidance to better serve those in need. Actually, during this tour, what also impressed me is that in many places, the vulnerable people, meaning the elderly, have been given special attention. In a neighborhood, also in Baoshan City, those aged over 60 have been classified into 3 groups marked by different colors in a special management system. Red represents those with underlying conditions and who should be given priority. According to local officials, they would pay a visit every day to learn about their latest health conditions. And if the elderly feel uncomfortable and can't move, they will contact the local doctors to provide visiting medical care. Speaking of visiting service, here in Yunnan province, many counties are providing medicines, sending medicines to villages, and local villagers can get diagnoses and medications free of charge. So actually, from my observation, the vast rural areas are not in a mess or in a panic as many people have supposed. So I think these areas are, of course, facing challenges, but as far as I know, they are confident in cope with the possible rise in infections. Back to you.
Well, thank you, Jinghao. That's our correspondent Yang Jinghao reporting in Kunming, Yunnan province. And back to our guests, Shujie, as reported, so the rural area, small towns, villages in Yunnan province, they were not much affected by the first wave of the infection. Does that represent the overall situation in rural areas, or are we looking at different pictures at different regions?
The situation is very similar in many other parts of the rural area in China. As my recent dialogue with my friend in Shanxi, in Chongqing, in Shenyang, and also Guangdong, the situation in the rural area is quite similar to what has been described in Jintao. The rural people, they have the special way of preventing this cold and also recently the COVID-19. There are lots of cases reporting people who get a fever, cough. The symptoms are extremely similar to COVID-19. Some people in the rural areas, they have a test, but most of the people, they didn't actually have a test. They just have some traditional Chinese medicine and also some painkillers, and they get over. So including some elderly, for example, my mother, she also have a fever, sorry, a cough, and he have some medicine from the village clinic. The medical doctor in the village clinic basically give the same prescription of a few tablets, mainly the painkiller and also some traditional medicines. And most of people get over from it after 1 or 2 weeks of cough and also a mild temperature. So the situation is actually similar to what I just heard. Not many people have very serious illness, but some sorts of mild suffering and also reduction of eating capacity for some elderly people. But for the younger people, they seem very easily. So this is the situation I heard. And the reason for this is because the rural people, they are fully aware of how to help themselves in terms of the nutrition condition, eating habit, and also keep distance with people. So even there is some sort of infection, I think it could be just very low dose of infection, and the symptom tends to be mostly mild.
Well, mild, Naijun, mild it may be. What about the percentage of infections in rural area? What about the serious cases, for example?
Well, I think on the whole, it is the characteristics of newer variant of Omicron. As we all know that the percentage of people with severe symptoms are less than other kind of variants. That is the reason that our country has changed the policy and downgrade the Omicron to the class B management and control. So I think I don't have the exact data because the exact data is not told to the public by the authorities. But in my opinion, I think the rate of people with severe symptoms must be very low. However, I think as we all know that the percentage of people who are infected might be very high. So that is the characteristic of Omicron, which gives us the incentives to change the policy.
So Shujie, you mentioned about your mother also lived in the village now, and we know that in China the rural areas usually they are is less equipped with say the availability of medicines and related equipment, as well as probably access to hospital beds, for example. What about now? At the beginning of this infection, we know that in the Chinese urban area, for example, there's a shortage of medicine, etc. What about now? Are we having enough supply of necessary equipments and also medicines?
Yeah, to the connection of my friends and family back in China, I think the situation is not as serious as in the big cities, because the big city mostly is highly crowded, and if one person get infected, the other people will find it quite difficult to escape. And the urban people, they tends to rush to the big hospital for help of medicines. But for the rural people, actually the people, they seems to be much calmer, in the sense that if they have a mild fever and a cough, they drink water and some sorts of small help from the local clinic. And as I observe, I think fairly few people get into fairly serious illness that they need hospital treatment. So it's quite surprising in the area which I'm aware of, the serious cases in the hospital are not necessarily linked to the COVID-19. They are basically the people with basic illness. and the supply of painkillers and other medicines seems to be not a real issue for most of the people in the village. And many people, they get the infection, although they know the symptom is similar to COVID-19, but they don't really care. So they just have some sort of medicine and drink water and rest in the house, and they get over in a week or 2 weeks. Some people may last longer if the physical condition is relatively weaker. But it seems there's no panic in the village at all.
No panic. Yes. Naijun, tell us about, in particular for our audience, overseas audience, how different is the medical system in the rural area from that in urban areas? If someone from a village, for example, was seriously infected and needed hospitalization, where do they go? Can they receive a proper treatment with village doctors or hospitals in nearby towns?
Okay, I think to our overseas audience, there must be a difference between the healthcare system and the mechanism in China and other countries, for example, in European countries, in United States of America, etc., etc. I think in foreign countries, there is a very strong hierarchy of healthcare system, the primary care and the secondary care. That is to say, the people, whenever they have healthcare issues, first they will go to their general practitioners, so-called GP. Without GP's permission, they will have no access to any hospital services. That is the so-called hierarchy of healthcare system from primary care to secondary care. And in China, I think we are going to build this hierarchy of healthcare system, not only in rural areas, but also in urban areas. However, it needs time because we only begin to nurture our own general practitioners back in 2009, only nearly 12 to 13 years ago. So I think right now we are not in a hierarchy of primary care, a hierarchy healthcare system. That is to say, whenever people have healthcare issues, they will go to the hospital directly, not only in rural areas, but also in urban areas. So I think if we know this difference, then we can look at the rural areas. In rural areas, I think in village level, there are only some kind of very fundamental healthcare services. While in county level, there may be one hospital, but only, I'm afraid, at the most, the second level. However, in our city, in our urban areas, that is the most famous hospitals are located. So from this point of view, we can say that in rural areas, people is very difficult to get advanced healthcare services. And I think, fortunately, because of the characteristics of the Omicron variants, as we have said before, the majority of the people who are infected only have mild symptoms or without symptoms and all. So I think just as we have mentioned that we do not have to be panicked. This kind of Omicron virus may not that serious. But as we all know that we are getting ready for the future new variants, so I think we still need to build on our hierarchy of healthcare system, especially in rural areas. And from the healthcare insurance system right now, I think we have built a national network. That is to say, when rural areas want to go to urban area to have healthcare service in any hospital, they will be reimbursed by healthcare insurance. So I think from the demand side, from the supply side, from the expenditure side, we have a bright future. But I think we need time to build the hierarchy healthcare system, and we also need time to have the reallocation of healthcare resources.
Naijun, we know that with the travel rush for the Spring Festival, you have people basically traveling from urban area to the rural area or from one region to another. How likely is it that we are going to have a new wave, say in the wake of the Spring Festival, and how prepared are the rural areas in general?
I think we must be prudentially optimistic about the Spring Festival's issue. As we all know that the majority of people have been affected in urban areas, so it means the majority of them has antibodies, which will keep them immune from the infections for at least 5 to 6 months. So I think if urban area traveling back to rural areas, we don't have to worry about too much. However, as the number of the population in China is so huge, so we still to be alert or cautious. That is to say, we still have to encourage people to keep social distance, to wear masks, to wash hands whenever they get back, etc., etc. And when they get back in rural areas, if they have elder population in their family, they still have to be cautious. So we encourage them to wear masks when they are going to contact with the elder population back in their rural area hometowns.
So Shujie, obviously, Naijun mentioned about this vulnerable group, the elderly, in particular those probably in their 80s and above. How do you, first of all, how do you assess this threat with the Spring Festival holiday that might increase, or I mean, we would say likely to increase the infection? And also, should we focus on the vulnerable group more, probably, with the likelihood after the Spring Festival?
Yeah, the Spring Festival is the major holiday for all the Chinese people, especially lots of people living in the village or associated with the village. They work in the city. They normally go back home to see their parents and relatives. So the Spring Festival is quite a lots of people traveling, so the risk is inevitably higher. Luckily, a lot of villages they have these kinds of COVID infections before the Spring Festival. A lot of people already have some, symptoms, as I just mentioned, and it's quite a high percentage of people in the village have been infected already. Luckily, the symptoms have been, mostly mild, particularly including the elderly people, which I'm most concerned because they were very reluctant to have vaccines before the open up policy recently. But those people, even they didn't have the vaccine, they went through this quite, miraculously without significant illness, and this is a very good news for the countryside and for the elderly people. Now, their children relatively coming back to the village, they are right to keep some distance, not to have big gathering, particularly with lots of people eating together and watching a theater performance together. If they can contain the kinds of behavior of like in the past, too many people crowded together, I think the risk could be significantly reduced. And this awareness, I think, is come from inside of the household and also for the people. For instance, my village, although I didn't go back to the village, my relative keep sending me information, including my mother is 90 years old and also her friend. They were fully aware of not to meeting frequently, far before the Spring Festival, and that possibly helped them to, go over through this confection. So this is a encouraging situation.
Encouraging awareness.
But as for the future, I think this group of people need some further protection in terms of prepare for the medicine and also some sort of vaccination, if possible, to make sure they can go through the second wave and some potentially future wave.
We have Michele now joining us. Michele, we know that in Italy, like nearly 30% of the population live in rural areas. I mean, how different is the situation? I know you are also familiar with the Chinese situation in terms of the medical services, availability of those services. What are the experiences for Italy to deal with the infection in the rural areas?
At the beginning of the pandemic back in 2020, the first areas that affected people were indeed some small villages rather than big cities. And so indeed, we did put a lot of resources in terms of medical ICU units exactly in the rural areas, maybe by luck, because it was there that the virus started to emerge in a small villages in the northern part of Italy. The health system in Italy is of course strained financially. because over the last few years we have invested less than we should have. Maybe, of course, no one would expect such a big pandemic. We also have constraints within the European Union in terms of budget deficits and the expenses. And to complicate things further, the health system is run at a local level by local governor in each of Italy's 20 regions. So we have a national expenditure plan, but then each region has its own investment plan and even quality of services. So what we see is, in a way, maybe similar to China, people who live in areas, not just rural, urban, but in regions, so let's say in the southern parts of Italy, where the health system may be more strained and less efficient, they tend to maybe to get cured in other parts of Italy in the northern parts. So what we are trying to do now is actually to rebalance this. As you know, in Chinese, crisis is also an opportunity to put more investment in those areas, rural and the southern parts of Italy, where the health system is not as good as elsewhere, and also to launch within the European Union a plan that we can actually have a little bit more freedom to go over budget if this is indeed well spent to protect the lives of citizens.
Mm-hmm. So Michele, based on the experience of Italy, how likely is it, right after a holiday, for example, Christmas, etc., because for family reunions, for people to meet each other, and then usually people say there will be a new wave of infection after that. Of course, the Chinese people are very much concerned with the Spring Festival.
I think if you look at the numbers I've read, and please tell me if the number is correct, about 60,000 diseases in China. Now 60,000 is about, in a month, is exactly 2,000 per day. And if we arrange for the population ratio between Italy and China, is exactly what we have in Italy. We have 80 people who die every day, which is comparable in terms of population. So we are in exactly the same the same situation. I tell you, the feeling here after the Christmas holiday is pretty much normal. People have accepted that they may get COVID. They have accepted that the symptoms may not be as serious as the very first wave 3 years ago. I'm not a virologist, so I don't know why, but it seems that the new variants are less deadly than the ones before. So people kind of accepted to take it. And so there is very little limitations in terms of movements. Wearing masks now is not compulsory anymore on trains, on planes. And maybe just going to hospital, people need to wear masks, but it is mostly out of an habit rather than a real attempt to contain the virus. I think in a way we have learned to live with the new, less deadly variant, kind of a herd immunity and good vaccination rate for what it's worth, because we know it's the case also after a few months. But it is not in people's mind anymore. So I hope this will be the case also in China, that we refocus now on the economic growth, which is at the end of the day also what people care about too.
Mm-hmm. Well, on that note, we concluded today's discussion. Many thanks to our guests. You can also find us on the CGTN app on YouTube. I'm Xu Qinduo. Thanks for being with us. See you next time.